My name is Jill Medrano, and I'll be going over my PowerPoint on psychopathy in children. For my introduction, I have some facts. Psychopathy is actually not very common. Only 1.2% of men and 0.3 to 0.7% of women are professionally diagnosed with it. This percentage is higher in prison, where it gets to 15 to 25% of prisoners have a significant levels of psychopathic traits. Psychopathy is not a formal diagnosis anymore, but it was in the DSM at one point. It was taken off in the 3rd edition. Psychopathic traits in children should be researched. Children often aren't diagnosed with psychopathy because it is oftentimes stigmatizing. Intervening early can help get to the problem before it gets to an untreatable thing. For the rest of my PowerPoints, I will be going through 4 different themes. My first theme will be traits of psychopathy. I'll then go on to talk about the differences between sociopathy and psychopathy. I will then go and explain why children can't be diagnosed as psychopaths. And lastly, I will go over some of the interventions that have seen good results. For our first theme, traits of psychopathy, pathological lying and manipulation, lack of morality and rule breaking, lack of empathy, narcissism, false superiority, psychological bullying, and self-serving victimhood are kind of the big factors in noticing it. There are usually deformities in the prefrontal cortex, which this is the region of the brain commonly known to be responsible for the capacity to understand other people's emotions or empathy. Going along with this, there's a photo here of a brain scan, and it's just kind of showing here on the left side, it shows the prefrontal cortex has a difference in psychopaths compared to all other people. We can also see that there is differences in the amygdala. Towards the bottom there, it just shows that there's either more or less activity in either. Usually, the amygdala is actually smaller than usual in psychopaths, and psychopaths also show lower activity in the amygdala. To be considered a psychopath, there is a psychopathy checklist revised test, which has 20 psychopathic personality traits. A person must be rated on each of these individual traits with a number from 0 to 2, and you have to score at least 30 to be considered psychopathic. Moving on to my second theme, psychopaths versus sociopaths. Psychopathy is more of a biological genetic viewpoint in the traits. Sociopathy is often seen as a result of environmental factors or negative sociological factors like neglect or abuse, peers and delinquency, and upbringing. Sociopaths often tend to be more impulsive and erratic, and psychopaths are usually meticulous in planning crimes, while sociopaths often meet with violence erratically and unplanned. In looking in both of these types of people, they have the same types of traits. There is one type of thing that's kind of different, but what is seen as psychopathy is more so born with, and sociopaths often are grown into this type of mindset. Looking over to the photo to the right, it kind of just shows like a versus photo. Psychopaths have a lack of guilt, remorse, and empathy, and sociopaths have a lack of remorse, but guilt and empathy may be present in some cases. Um, Another kind of difference is psychopaths pretend to feel emotions, and sociopaths, some emotions are felt, like rage, but are shallow and fleeting, more like surface level. Psychopaths have an inability to form true emotional attachments. Sociopaths may form close attachments to one or a few individuals in which they have common um, relations with. Psychopaths tend to be more successful. Um, Sociopaths have consistent responsibility and repeated violations of the law, which kind of goes into what I was talking about, where psychopaths are more meticulous in planning, where sociopaths are often impulsive, and that's why they get caught up more with the law, and they don't often think as hard. Psychopaths are dishonest, and so are sociopaths. They're constantly lying and having deception. Um, Psychopaths have manipulative behavior, narcissism, and superficial charm. Sociopaths are often just aggressive and have reckless behavior. Continuing on with sociopath and psychopaths, psychopaths often thrive in their careers because they can manipulate others to trust and like them. Psychopaths may channel their tendencies in more organized crime like white collar crimes. Psychopaths tend to be more charming, and relationships are only valued or put in effort into only to benefit from them, while as sociopaths are able to feel empathy and guilt but still continue the impulsive and erratic behavior because they're not in control of it. They're not doing it to manipulate, they're doing it because it's just impulsive. Psychopaths are better at disassociating from the actions which they do because this is what leads to the little or no feelings of guilt. Above, I do have a picture signaling kind of the top 10 jobs that attract the most psychopaths. We have CEO, we have lawyer, media or TV radio, salesperson, a surgeon, journalist, police officer, clergy person, a chef, and a civil servant. Going along with these, as a CEO or media, TV personnel, salesperson, those jobs are often met with trying to not manipulate people, but more so have a good face on and be liked by others, which psychopaths thrive in because they can just kind of manipulate their own personality to be liked, and they can gain more in these jobs as a big CEO or someone that is in charge of media or selling you a car or something like that. Along with that, so with a lawyer also, they often fight for people, and they can kind of manipulate the jury or manipulate the judge into seeing kind of their viewpoint and what in that. Moving on to my third theme, why can't children be diagnosed as psychopaths? Oftentimes professionals do not like to label an adult as such because of the lack of understanding and the stigma it glues onto the person, and of course the fear. So with psychopathy having a stigma of evil or deserving to be punished, they don't often put it as a diagnosis to children because they don't want that child to be put in that category, or with the lack of understanding in it, we have no idea how to even try to intervene with children, so they kind of just take it away from being diagnosed. Psychopathy is a spectrum disorder, so to determine early signs can be very difficult. Along with being a spectrum disorder, there's a lot of different signs, there's a lot of different traits that can go on. It's not just like so set and serve where you say he has this, he does this, he's a psychopath. It's more so like this is kind of how he acts, he does this also, he has another trait like that. So it's very hard to even determine signs or diagnosis. Due to the variant of signs in children and the limited knowledge of psychopathy, the behaviors that may be considered as signs are not used in original screening procedures. So when screening a child for mental health or any other thing like autism or ADHD or anything like that, they have certain behaviors that they would say, oh, do you have this behavior in this setting? How many settings? Well, because there is such a large amount of signs, not a large amount of signs, but such differing type of signs, they can't even use the traits that we per se say are for psychopaths in screening procedures. Again, talking about why children are often not able to be diagnosed as psychopaths. Children showing signs are often diagnosed with conduct disorder, which is a disorder that is a pattern of breaking behavioral norms and violating rights of others. Conduct disorder is commonly grown out of. There is one subtype called conduct disorder with callous and unemotional traits, in which it stays consistent from childhood to adulthood. And this is kind of where professionals see it as, we're waiting for you to be an adult to be considered a psychopath. That consistency coming from childhood to adulthood is what they want to see, because conduct disorder is often grown out of. Instead of, putting this stigmatizing diagnosis into children, they put it with a less stigmatizing diagnosis of a conduct disorder. The psychological field does not see it as a treatable or a defined diagnosis, and that is why they chose to remove it in the third edition of the DSM. In treatable, we have no understanding of how or why or what we can do, because we haven't really gone into studying it or even looking at it in a child. So, and it's not defined because we have all this mixture of signs in children, and we can't diagnose them, so they just took it out of the DSM because there's no way to use it in the DSM. There is not enough research or knowledge of understanding it or how to properly intervene with it, and that's what scares most professionals, and that is why we can't often put it to someone or, put it in the DSM, because then we have to admit that we have no idea how to intervene. Going through now, I will be going through kind of not the signs, but kind of just some behaviorals that we'll see in the different sets of ages. And of course, due to the varying of signs in children and the limited knowledge of psychopathy, these behaviors that may be considered as signs are not used in the official screening procedures, like I said before. So in talking about preschool age, which is age 2 to 4, there would be unusual risk-taking behaviors. There would be no reactions to fear or sadness, and there would be limited eye contact compared to peers. And looking in early childhood, ages 5 to 10, children may not show affection. They will still break rules and show aggression more so than other peers. Children will also not have any reactions to consequences. And that's kind of just in the age group where people more so start seeing it as a problem, because, most children react to consequences. They'll be sad, they'll be mad per se, but, when you have a child and you give them a consequence and they're just very nothing, then that's kind of concerning to some people. Going on to adolescence, ages 11 to 17, guilt will not be shown when something has been wrong or something has been committed wrong. The adolescent may act superior to others and will have difficulties keeping friends. That's kind of the narcissism and false superiority. Individuals may not care about school performance and more often than not will participate in illegal activities, which kind of goes into the unusual risk behavior we see in the preschool age. So going along with that, I have a photo to the right of potential treatments for children with psychopathic traits. We want to teach them problem-solving skills. We oftentimes want to put them in a residential treatment option, so for the safety of others and themselves. And the main thing we like to do for treatment is recognizing emotions, because as a child with psychopathic traits, you don't have emotions. And so recognizing emotions and kind of identifying them and kind of pushing them into a child's life could be all more so that well-being. You got to practice empathy and practice pro-social behaviors. This is a lot easier in a residential treatment option because you're more so one-on-one. You have to basically just teach them how to have emotions and how to have empathy. And, oh, little Sam over there ripped his knee. I bet he feels sad. As a person with psychopathic traits, he'd be like, I don't care. But then you gotta show them, no, like, you have to feel bad because, that hurts. And when things hurt, we have to feel bad and stuff like that. Moving on to the last theme of interventions. Interventions are usually not seen for people under 18. Going along with what I said before, they don't give it's not an official diagnosis, but they don't really recognize it as a problem until it's in adulthood. They put it more so with conduct disorder, in which, there is interventions for, but there should be different ones. The ability to treat psychopathic traits gets harder the older one gets. Going along with what I said in the past slide, where you need to, teach them how to have emotions and teach them empathy and teach them emotions. It's obviously going to get harder as one gets older because they already learned this type of life and they aren't going to be more open to this is what happiness is, this is what sadness is. They're just going to not listen and not care. There also has been a different type of therapy that we have seen. It's called schema therapy, which kind of goes along with what I've been saying. You address unmet emotional needs. So any emotional needs that they're not having, you want to meet those so that they aren't in a bad set of mind, or that they're emotionally intelligent. And of course, with that therapy, you need to moderate extreme emotional states, because in any diagnosis, in any mental health, extreme emotional states is where the bad things happen. Next, I will talk about parent-child interaction therapy, which is also known as PCIT. In this therapy, parents are encouraged to emphasize positive reinforcement, and they are supposed to teach how to become warmer and responsive in their parenting, and how to coach children to pay attention to other people's emotions, which is something that is repeated over these slideshows. We need to pay attention and teach these kids emotions and how to react to these emotions, so that it's kind of a learned behavior, rather than one that's just ingrained in your brain. PCIT is obviously a therapy used. You want to kind of emphasize positive reinforcement, and what that means is, if someone does something wrong, you don't punish them for it. You rather wait until they do something right, and then you reward them for it. You don't pay attention to their bad behaviors, you pay attention to their positive behaviors. You want their positive behaviors to be known and rewarded for, and so that it kind of has a learned behavior of, I need to do more positive things, or I would rather have these rewards than not. This type of therapy is actually seen in two types of residential treatments. One is seen in Boys Town in Omaha, Nebraska. There are other residential treatments across the U.S., but the main one is set in Omaha. And in this residential treatment, children live in homes with trained married couples who are known to them as family teachers, and they mimic the idea of PCIT. So instead of the parents, participating in this type of therapy with the family, they're sent to a residential treatment facility, and they live with trained married couples who are not their mom and dad, but they mimic their mom and dad, and they mimic the idea of PCIT where they learn this. Another place that has seen success in this therapy is the Medrano Juvenile Treatment Center. They use the decompression model along with PCIT. And so, that goes, instead of going the normal route to control their inmates, they reward inmates for good behaviors. If the behaviors are better, the reward is better as well. So it kind of shows the child, a very easy way of getting a reward and a very easy way to get a better reward. So they don't control their inmates, they more so treat them in a type of treatment. The last type of intervention that I'm going to talk about is transcranial magnetic stimulation, which is known as TMS. This actually has been shown to potentially increase empathy. TMS is using electrical currents to stimulate particular areas of the brain. In the research, they have used TMS during empathy tasks and found that violent forensic patients have had a reduction in aggression on the same task a week later. So explaining this, it's like, so if you look at the picture below, they have this device, and this device sends electrical currents into the brain, kind of. It doesn't, you kind of feel it in your head, but there is electrical currents going into your brain, kind of in the specific parts where, let's say, empathy is seen, or they do a exercise where they say, how would you feel if this person did this, kind of mimicking empathy, and then they do it again after doing some of the currents in your brain, and they have seen that this could potentially increases empathy. um, I will now go through present investigation of children who showed psychopathic tendencies. The study will focus on children under the age of 18 who committed murder. The aim of the research is to investigate children who are considered psychopathic after they committed murders and see if there were signs present before the killings. This is accomplished by research of interviews and articles after they committed and were convicted to determine warning signs and to see if those warning signs were present prior to the murder and in their childhood. This research will explain that if mental health professionals took initiative to acknowledge that psychopathy can exist prior to adulthood, then there could be steps in how professionals could learn to approach the diagnosis without fear and attempt to stop the diagnosis to a point of danger, like murder. The methods taken in this study were 6 participants. There was 6 children in total, 3 female and 3 male. Their names are Beth Thomas, Alyssa Bustamante, Mary Bell, Paris Bennett, Eric Smith, and Amarjit Sada. The procedures in this study were done by a collection of information from credible articles on the internet and interviews of said children in their childhood or when they were incarcerated. This will be measured by researching each participant and finding articles and interviews to find specific type of warning signs or psychopathic tendencies that they had in their childhood or prior to the murders. The results were formulated to understand traits that could be acknowledged as for psychopathy and then intervened with before so that they could stop murder. Specific traits chosen were due to the way they are distinguishable, the traits that were most different from normal children, and the traits that were most reoccurring in cases of psychopathy. Our first result will be Beth Thomas. She was 6 years old when the documentary of Child of Rage came out, which highlighted her disturbing behaviors such as violent outbursts, cruelty to animals, and expressions of rage and aggression about her family. Beth would consistently state she would want to kill her parents and baby brother. Beth tried to kill her brother several times as well. If you look at the picture to the side, you'll see Beth Thomas at 6 years old. This is taken from the documentary. The interview asked her, "How could you kill mommy and daddy, Beth?" And she simply stated, "Stab them." I will now go through the traits that were taken into consideration to kind of highlight what would be something that would be distinguishable to acknowledge in a childhood. In Beth's case, for her, I found several things that where she showed no reaction to other sadness or fear, and where she did not show affection at all. In the documentary, she stated that she would not stop hurting her brother despite him saying to stop, or despite their mom saying to stop. She just continually kept hurting her brother. She would have no affection towards her family. This is shown when she says that she would stab them and she would kill them. And she has no emotion when encountering past sexual trauma. At one point in the documentary, Beth entails of sexual trauma that she had from her father. She goes into detail about it all, and she does not show any sadness or any fear, any anger. It's just in an affect type of mood. Continuing on, she has shown that she does not have any guilt or empathy. This is shown when she has no remorse or guilt or empathy for the pain that she inflicts when she would bash her brother's head against a wall, or when she would talk about wanting to kill her parents. She never said that she felt sorry that she did. She never said that she didn't want to do it. She just said it without any emotion at all. She would kill baby birds, and when this was confronted to her in the interview, when they said that she killed the baby birds, she showed no guilt, and she didn't have any type of sense that she shouldn't have done that. She always acknowledges the actions, but she does not show any sign of remorse for what she does, whether it's baby birds or her brother. Excessive misbehaviors shown from Beth in the documentary. It says that she has excessive lying, and she excessively stole things like knives and killed baby birds. She would hurt her brother. Just misbehaviors that are not normal for a 6-year-old. In talking about the knives that she stole, at one point she stole knives, and her mother did not tell her that she knew that she stole the knives, but Beth randomly brought it up and said, "I wonder where those knives that were stolen are." That just shows that she does not care for what her actions are. There's no sense of any emotion in that. The next participant we will go over is Alyssa Bustamante. She was 15 at the time when she murdered her 9-year-old neighbor. Her mother had a terrible history of drug and alcohol abuse and criminal charges / jail time, as well as her father served time for assault. She was mostly raised by her grandparents. Alyssa stabbed, strangled, and sliced the throat of her neighbor just to feel what it felt like to kill, in her words. Alyssa's diary recounts the murders also as amazing, and Alyssa has also been known to inflict pain to her brothers. To the left, you'll see one of her Facebook pictures that we will reference later on, where she has a painted red picture by her mouth that shows kind of what is meant to be blood. And then you will see her mugshot where she is smiling, which we will reference later also. Again, she does not show any reactions to other sadness, fear, and she has no affection towards anybody. She does not have any affection to her brothers when she would inflict pain. In a home video that she posted on YouTube, she forced her brothers to touch an electrical fence. In the YouTube video, she does state, "This is where it gets good. This is where my brothers get hurt." That alone shows how she has no sense of feeling of compassion or affection towards her brothers. And when they did touch the fence, she felt laughter rather than sadness or confusion. She shows no guilt or empathy in anything that she does. She had no remorse when she was arrested. She wrote in journals that the slaying was amazing and enjoyable, and her grandmother actually stated that Alyssa appeared happier the next day after she murdered. Excessive misbehaviors that I found from Alyssa was that she would post pictures of um, mock stabbing her friend. So she would pretend to be stabbing her friend in pictures and post it on social media. She would post pictures with a knife that was colored red at the end, trying to show like it was blood. She listed her hobbies as cutting and killing people on her YouTube profile, and she was known to overdose on pills many times. She would also slice and carve into her skin. Continuing on, the next participant is Mary Bell. Mary Bell was 10 years old when she murdered 2 boys. She strangled the first victim, who was only 4 years old. Mary was then investigated due to the notes found admitting and referring to the death, which are to the left. A month later, she killed another boy by strangling him and cutting the body with razor blades. Mary's childhood was filled with abandonment from her mother. Her mother actually attempted to give her away to relatives several times and even attempted to give her away at an adoption agency. Mary also had several drug overdoses done that were not her choice. Her mother just overdosed her. Mary's mother would also prostitute her to men. Mary actually witnessed her friend be killed at the age of 5 as well. To the left, you'll see a picture of Mary around the time that she murdered. And if you look at the note below, it says, "We did murder Martin." And then on the right side, he said, it just kind of references the murders that they did, and that's why she began to be investigated. Continuing to her no reaction of other people's sadness or fear, and her way of showing no affection to others. She was cold and detached as a child. She, at 2 years old, would refuse to bond with anybody, and when she choked a student at school, she asked her teacher why. She had no reaction to the victims' families when she asked to see the body or laughed at the funeral. Mary shows no acknowledgement of other people's feelings, as she would, instead of, when she choked a student, instead of being like, "Oh, I am so sorry," or "Are you hurt?" she said, "Why would I not choke him?" And then obviously at the funeral asking to see the body and laughing at the funeral. That is no sense of other people's sadness. For the no guilt and empathy, she actually interjected herself investigations of the murder she committed. She wrote notes at her school about being responsible for the deaths, and a psychiatrist expressed that Mary showed classic signs of psychopathy at the trial, and she showed no anxiety or remorse at the trial as well. Excessive misbehaviors. She was actually known as an avid liar, even in childhood. She was known to be and said to be manipulative as a child. She was violent to animals. She was a bedwetter till she was an adult. She strangled children, and she is known to have pushed off a child off the roof. The next participant in the study is Paris Bennett. Paris Bennett was 13 years old when he raped and murdered his 4-year-old sister. He admitted to the murders, and when he admitted to the murders, he had said that it was an attempt to inflict the most misery upon his mother. Paris manipulated his babysitter that night to leave to murder his sister. He stabbed her 17 times, and he was sentenced to prison, and he was interviewed years later, which is one of the references that we will use. When interviewed, he talked in a very monotone voice and showed no ounce of emotions and refused to talk about the murders in any way. In old home videos, he would often say that he wanted to kill his sister. To the left, at the top, you'll see a picture of Paris when he was a bit younger and his sister. And then below, you will see him in the most recent interview that he has had. Paris had no reaction to other people's sadness or fear, and he showed no affection. He reports in the interview that he had that it was hard to stop stabbing his sister, which would show no reaction to his sister's sadness. He was adamant in expressing that the murder was to hurt his mother by taking both of her children away, by killing one and putting one in prison for the rest of his life. In the 911 call, he lied about giving CPR to his sister, and in the interview, he struggles in trying to describe the love that he had for his sister. All these, show that he has no sense of other people's sadness, and he does not have any affection. He can't express his affection about his sister either. For no guilt and empathy, in the interview, he has a flat affect in talking about the crimes and feelings. Whenever he is asked about what he loves about his sister or if he feels sorry for it, he turns away at the question and refuses to answer. He cannot show any guilt or empathy, and even when he talks about he does not talk about the crime very much, and he tries to avoid it because he cannot show that empathy towards the crime. He does express the guilt, but his affect does not show that he has guilt. It's just the same flat affect in anything when he's talking about anything else. When he was interviewed by the police, he didn't cry, or even when they were telling him about the details about the murder, he didn't show any emotion. Later on, he would state to his mother, "I enjoy watching your pain," while he was in prison. He appears very happy about how the murder turned out in the interviews. Excessive misbehaviors from Paris. He was known to be obsessed with shooting and killing. He would bang his head against the wall when confronted about misbehaviors. He would wave knives at family, and he made threats to his sister in home videos. In evidence, it was actually shown that he had looked up snuff films before murdering, and that he watched violent porn like SMN, bondage, and sadism. The next participant is Eric Smith. Eric Smith was 13 when he tortured and murdered a 4-year-old. Eric lured him into the forest and beat him in the head with a rock, and also sodomized him with a stick. He poured Kool-Aid into the wounds of his victim, and after the murder, he inserted himself in investigations and later confessed after the funeral. He claimed that he just saw him and wanted to hurt him. Eric was denied parole 11 times. To the left, you'll see Eric at the age of 13 when he was on trial for the murder, and then to the right, you'll see him kind of more in a present view when he was in prison. This study showed his no reaction of other people's sadness or fear, and his way of showing no affection. He would interject into the investigations, and he was said to kind of enjoy the reenactment that the police conducted of the murder, showing that he had no acknowledgement to other people's sadness about the murder. At trial, he also showed no anger, more so pleasure about being on trial, and he admitted to wanting to hurt people all the time. He doesn't show any guilt or empathy. This is shown by when, even at his parole hearings, years later after the murder, he would express that the murder gave him a good feeling. He would actually also state at a parole hearing that he would do it again if he was not caught. Excessive misbehaviors shown by Eric were that he would burn his own face as a child. He would have very violent outbursts. He would also be able to make a makeshift weapon and kill a cow with it. He would also bang his head as a toddler excessively. The last participant is Amarjit Sada. Amarjit murdered 3 times by the age of 10. He is known as the youngest murderer in the world. His family knew of the first 2 murders but refused to do anything as it was family matters. His first murder consisted of him choking a baby. He was said to return very nonchalantly after. His second murder, he went on to murder his baby sister, who was only 8 months old. And after that, he kidnapped a 6-month-old from a daycare and killed her also. At police interviews, he always had a cool demeanor and smiled throughout, and even demanded a biscuit to make him talk. To the left, you have a picture of Amarjeet at the age of 10. There's not any pictures of him recently, as his identity and everything has been changed for his own safety. Amarjeet had no sense or reaction to other people's sadness or fear, and he had no affection towards anybody. This was shown by his amusement in the cries of babies when he would pinch and slap them. He would have no emotion when recalling the murders to investigators, and he had no reaction to killing his own sister. By a psychiatrist at the trial, he was labeled as a sadist who derives pleasure from inflicting injuries. He had no guilt or empathy, and this is shown when he was in custody and he smiled about the murders. He was not remorseful at all or sad in interviews, and when asked about the murders, all he did was demand a biscuit. He continued murdering until he was caught, which would show that he had no guilt about the murders. Excessive misbehaviors from him. He would pinch and slap babies for enjoyment. He choked his sister often, suffocated other babies, and kidnapped a baby from the nursery. The discussions on this study and participants are as follows. Early signs of psychopathy are shown in children as young as school age. The results of this study, prior research to advocate for psychological professionals to acknowledge children showing signs of psychopathy. The discussion to push psychology world to stop the escalation of psychopathy, but before murder. The signs or psychopathic tendencies that are discussed are no reaction to other people's sadness, no affection, the way of no shown guilt or empathy, and excessive misbehaviors. All participants showed several situations prior and after murder showing these signs above. In some cases, when intervention was given, it actually created better outcomes. The limitations of this study: there is no intervention or psychological diagnosis prior to murders. All the information we have are other than their childhood and the signs. We don't have much information after the or prior to the murders. Some whereabouts of the participants are actually unknown due to identity changes, so this limits our way of saying if intervention would help or if it did help. Some participants also did not receive intervention after murders, so this would stop us from being able to prove that intervention helped because they did not receive any. The sample size is also very small. Changes that could be made to limit this study: interventions should begin as soon as signs are seen, not just after the diagnosis of psychopathy can be said. We would need a bigger pool of samples, and we would have to expand on concise signs of psychopathy to make it more beneficial to be able to pick these signs and pick them out from each participant. Concluding my PowerPoint, the main themes or ideas I'd like to educate is psychopathy is a spectrum of traits and behavior. Medical, psychological, criminal systems tend to look away from psychopathy due to the lack of understanding and uncertainty of it, which can be very problematic. There are promising treatments, but people don't want to identify youth with psychopathic tendencies due to the stigmatizing of it, which makes it harder for these promising treatments to work because, as I said before, these treatments work less after a person reaches adulthood. Attempting to fund research for psychopathy is also difficult because no one wants to be up to fund such a troubling diagnosis. Nobody wants to put money into helping these people who are untreatable or violent or aggressive or, evil per se. No progress will be made until society takes a step in understanding the term clinically, legally, and publicly. It is a real medical and psychological problem and should be dealt with as that.